CEO of Wish Foundation. I'm really happy to see all of you here. A warm welcome to the Scale Healthcare Innovation Summit, which is being organized by Wish Foundation. Just quickly, the reason for holding this summit is essentially threefold. One is that we are focusing in primary healthcare area, and that this is the most important thing, yet there are several challenges involved in that. Innovations are talked about. India is supposed to be the hotbed of innovations, but then there are challenges in scaling up innovations. There are lots of innovations that one keep hearing about, but when it actually comes to scaled up innovations, there are very few. You go to any of the platforms, any of the conferences, you keep seeing the same old names coming back and again. So the whole idea is to sort of understand these challenges, understand the opportunities, what are the bottlenecks that we need to sort of address, and how do we get there. And it is in this context that, a very interesting panel, and looking at the number of chairs, I think this is the world's greatest and the biggest panel. So all of them will be sitting and discussing things. And on top of that, all of you will be there, so don't worry about it. So it's a great panel that we are going to have. And this panel has to come out with an action plan, and it's not just discussions and ideas. It is some action plan which we will formalize, and at the end of it, we would like to share that with the Ministry of Health. We have dignitaries from the Ministry of Health in Delhi. We also have very senior representatives from the Ministry of Health. From Rajasthan is one of the priority states where we are focusing, other than Madhya Pradesh and Orissa. Somewhere during the session, I will explain why we are talking about these three states. And then, of course, this provides a great opportunity for all of us to meet, share, network. We need to build that ecosystem that will help overcome many of these challenges that we would be discussing today. With this, I would like to show you a film which has been developed, and this sort of very, very briefly tells you what Wish is all about and what we are trying to do. So over to Himani, can we just dim the lights, and can we have the film, please? Can somebody dim the light first? Can somebody check the volume? And then can you put it on, please? Can we have the lights off or dim? Can we have the lights, please? Thank you.
Every time I come here, the country looks more and more like a nation that means business. A country that's growing from strength to strength. But when it comes to health and healthcare, it appears that we are in need of some urgent remedies.
India is facing double burden of the diseases. On one side, communicable diseases are reducing, but on the other side, new communicable diseases are coming up. India is now known as diabetic capital in the world. Every third or fourth person is suffering from hypertension.
We have doctors and hospitals at par with the best in the world. But they appear to be out of reach for millions of people.
There are an estimated 85,000 doctors in the public sector, but at any given time there are only 26,000 doctors to cater to the needs of something like 850 million population.
गांव में हमारे यहाँ पर स्वास्थ्य बढ़िया नहीं है, क्यों हमें दूर जाना पड़ता है। गांव में तो कोई सुविधा तो है ही नहीं, फिलहाल कुछ भी नहीं है। तो खून की सुविधा है, अल्ट्रासाउंड की सुविधा नहीं है। अच्छे डॉक्टर होने चाहिए गांव में, वो नहीं है। और फिर दवाइयाँ तो सारी प्राइवेट हैं और अच्छी भी मतलब ज़्यादा असरदायक नहीं है।
Across India, there are so many people working towards an equitable healthcare system, using innovative approaches to reach quality healthcare to the poor. And yet, they are not adding up to be a viable force.
Innovation doesn't just mean doing something in a lab. So I think the biggest innovation is, once you take innovation out of the lab, you face a lot of challenges. Hey, we don't need funds from the government. We just need the networks and their, infrastructure so that they let us in and try out these tools with them.
Technology development or solution development is a long process. It's a complex journey which requires teams and which requires partners.
The government rolls out schemes. Innovators are struggling in their own cocoons of bringing out healthcare innovations. Investors are investing in some of the ones that they feel which can scale, but nobody's thinking together.
The more people I meet, the more I am convinced that innovative solutions can help us address our healthcare challenges. What's needed is an environment that encourages this ingenuity and leverages its potential.
Healthcare is one area where there are large unmet needs, and there is a scope for large innovation which is possible, particularly in India.
I'm an advocate of using whatever resources that are there and marshalling those resources in such a way that we can address the challenge in the healthcare space.
I realized that if we want to make a real, sustainable difference to the state of healthcare in India, we must create an ecosystem that incubates, supports, and scales up new ideas. And that was the genesis of WISH. At WISH, we find the most promising healthcare innovators and we help them to scale up. We demonstrate how to make innovations work at the ground level and how to scale them up. We create a knowledge hub, provide a free flow of information to innovators. We build an ecosystem to help innovators connect and collaborate.
I think it's a great vision, if you ask me. Finally, it is all about making a difference. And you don't make a difference unless you have a big impact. And that impact can come through the speed, scale, and sustainability. I wish, achieves this particular objective.
Ultimately, WISH is about fulfilling the most fundamental desires of people, health and happiness.
Thank you. The man who envisioned WISH happens to be here, Sunil Wadhwani. What can I say about Sunil? It's one of the best bosses that I've come across in my career. No performance appraisal, don't worry. He's been the principal donor for WISH, and he's been supporting through his family foundation based in US. All of you know him as the co-founder and chairman of iGate. He's been a successful entrepreneur. He's been an angel investor. He's been an impact investor. He's been a philanthropist. He's been supporting a number of healthcare innovation initiatives to scale up. The number runs into 30s, 40s, and he's personally sort of taken interest, has been doing it, and somewhere down the line he felt that there's a need for an institutional approach, and that's where he set up Wish, and that's where we all came in some time back. And he's been a guiding force. He's been involved. I've never seen a person knowing so much about healthcare coming from IT business. So it's excellent to have Sunil Wadhwani here. So a round of applause for Sunil. And Sunil, can we have some good words from you?
Good morning. You know, when I was looking at that little movie, Sumitro, it struck me that we should send it to some producers in Bollywood. The next time Deepika or Katrina are looking for a leading man, I can make myself available. Huh? What do you think? Sumitro is saying, stay with this. Don't do anything else. Well, thank you all for being over here. As you probably know, there are multiple conferences happening around town yesterday and today. Conferences in healthcare, conferences on innovation. And I have no doubt that the highest quality attendees are right here, having met so many of you. So thank you for being over here. Welcome. As Sumitra was saying, I grew up in India. I went to the US to get my MBA, and then I stayed on in the US. Over the years, I've started a few different companies, and the biggest of which has grown to about 35,000 employees. But I've also angel funded the creation of maybe 35 or 40 companies in India, in the US, and elsewhere. These are in fields like healthcare, life sciences, IT, social media, etc. Now, many of those companies have thrived, done really well, and many of those companies have not survived. You know, they've failed, they've closed up. But through that, you learn lessons, right, of what it takes to scale up innovation and what doesn't. So now I'm trying to apply some of these lessons over here. Over the last 8 or 10 years, I've also been able to fund a few NGOs in India in the healthcare space. And through them, I've traveled to remote parts of India, and I've seen firsthand, as we all have, how bad the healthcare system can be if you're poor, and especially if you're very poor and live in a village. The healthcare system in many states in the country is very dysfunctional. There is, nothing there. At the same time, so, as an example, a few years ago, I was traveling in Rajasthan, and I happened to meet a poor family over there, a lady called Parvati Devi in her mid-30s. She and her husband were subsistence farmers, very low incomes, and she had started feeling some medical symptoms. Intense backache, frequent urination, trouble sleeping, etc. So she didn't know what to do. These symptoms got worse. She got very tired very quickly. So she spoke to her local Ved, who prescribed some golis for her. She took them for a few days, no difference. She then saw her Asha worker, got some more golis, again, no difference. The Asha worker then, referred her to an A&M, then to a doctor. She went to the clinic, which is a long way away, as you know. Doctor wasn't there. Went back a second time, doctor wasn't there. Third time, finally, she saw the doctor. And each time, of course, the husband's with her. She can't travel on her own. They lose a day's wages. And the doctor said, well, you have to go for a blood test to the district hospital. The blood test will cost 350 rupees. And you know what happened? She didn't go for the test. She didn't get diagnosed. And she just progressively kept getting worse. Net, in the next month or two, she wasn't able to work anymore, so that already poor family, the income was cut in half, right? And with no solution and no end in sight. And there are millions of families to whom this happens in India every year, and we all know this. We all know this. Now, if we fast forward from that trip that I took at that time,